Hi, I'm Trent Warehan, Senior Consultant with the PT Referral Machine. Welcome to our preview video part 2. In part 2, we're going to preview how to use some of the latest technology to systematize and automate the delivery of all the stuff we talked about in part 1. Before we get into that, let's first talk about what you should be watching to know if your marketing is actually working for you. Most people think that the only thing to watch is the bottom line. Well, that is ultimately important. There are many other markers or cash drivers that can be measured before you have any idea if the bottom line has been affected. These items include things like website traffic, requests for information from your website, pages that people are visiting on your website, phone call tracking and recordings, referrals from both physicians and patients, free screening requests, and conversions from those screenings into patients. The advantage this gives you is that you'll know much sooner if your marketing is working. If it is, do more. If it isn't, stop before you spend too much money and try something else. Now, let's look at how we can automate your marketing system to free you up to do what you do best, and that is treat patients. Studies have shown that people need to see or hear your marketing an average of 7 times before they will respond and become a customer, or in the case of PT, a patient. What happens in most PT clinics when somebody calls for information about your facility or programs is, well, not much after the first phone call. The question gets answered, the caller hangs up, and maybe they call back when they're ready to book. But if there are any follow-up materials that could be sent, it would probably be a brochure at best. I'm not trying to slam PT clinics here, but the problem is that you and your staff are just too busy to try and follow up with those people. Even if you figure out some kind of system to send stuff out to them as a follow-up, it means you need to print a whole bunch of these pieces and have them sitting around in the back room to get any kind of price on the printing. Then a week or so after a prospective client has called for information, it's up to someone in your staff to take the initiative to go back and get one of those pieces you had printed, label it, put a stamp on it, and drop it in the mail. Sure, this might happen once in a while, but we both know that to do this on a consistent and timely basis is next to impossible. That's why we decided to use technology to do this for us. We help develop a system that will not only provide your prospect with the initial information they requested, but also follow up with them consistently until they make a decision to become a patient. And it does this with a combination of emails, follow-up phone call reminders to your office, and on-demand direct mail postcards and letters, which means we only print materials as we need them, even as few as one. There's no need to print large quantities anymore. We call this our patient relationship management system. Let's look at an example of how this works. In this example, we're going to use a newspaper insert. This one's specific for back pain, and the offer is a patient's guide to back and neck pain treatment options. They can request this by phoning the office and requesting it, or going directly to the website and downloading it in PDF format there. Now, this could be a clinic brochure or any other informational piece that you have, but we would recommend that it be very specific, because if you're talking to people about back and neck pain, that's what they're interested in. They don't really care about all the other things that you offer at this point. In most cases, this is where it would stop for most PT clinics, but that doesn't help that prospect in the decision-making process, and that's what you want to do. You want to take them by the hand and walk them through the process. Be the provider of information for them, because if you do, when they're ready to make the decision to make an appointment, they're going to call you. So what our system does is allows us to follow up in a systematic way with emails. This one may be sent out a week after they've downloaded their guide. Then we send a call reminder to the clinic saying you need to call this person and follow up with them. They've downloaded your back pain guide about a week and a half ago, and just make sure that they've received it. And this is an opportunity for you to upsell to a free screening. If they don't convert, you send them another email. Then a postcard. Again, remember, this is on demand. These are not pieces that you have to have sitting in your back room and have somebody go and mail them. These are sent out automatically from the system. A week or so later, they get another email, and then another postcard. And this series of events continues until those people decide to book an appointment. Once they do that, we need to educate them on what it is you do and what you need to, or what you would like to teach them before they come in about your clinic. Specific things about location. Maybe there's payment options that you want them to know about. Maybe there's a very specific procedure you have for filling out patient intake forms. You can explain that and have them downloaded through this email. Again, it's automatically sent out to them when they book their first appointment. They come in for their first appointment, they start their therapy. Now we need to educate them on what they can do to to get the most out of their therapy. So another email would go out to them. They would go through their course of therapy, and at the end of that, they're going to receive an online survey form so that we can find out exactly how you're doing. Most times things look really good, but you know what? There might be one or two items that can be drastically improved on, and we can find that out here. Do we forget about them at this point? Not at all. Because you know what? You provide a lot of other services that they don't know about. They've come in to get their back fixed, but maybe they've got a shoulder problem or a knee problem or something else that they need help with. And you can continue to follow up with them and upsell them to other services you provide. Maybe you have a health club as part of your facility. Now you can transition them from a patient to someone who is a customer at your health club. Maybe you just want to find out how are they doing after a month of being out of therapy. You know how people are. They don't necessarily always follow the regimen of exercises that you provided for them. You can send them another survey and possibly reactivate those people. Well, I know some of you guys are sitting there going, yeah, this is all fine if you want to market directly to patients, but what about physicians? Have you forgotten about them too? No. This system can also be used for physicians. By providing them with treatment-specific physician materials and then following up with them on a consistent basis, they'll start referring people for that very specific treatment. And you just start giving them materials for different treatments, and that cycle continues. And soon they'll be referring to you for everything that you can treat. Because we don't have a lot of time on these short videos, we can't possibly go through our program and how it works in a whole lot of detail. The strategies and systems we presented are just part of what we provide for our clients. So if there's anything of interest to you here on these videos, your next step is to see our system in more detail and sign up for one of our upcoming free 60-minute webinars. You'll find a simple sign-up form at ptreferralmachine.com/free webinar. Just choose a time that works for you and fill in the form, and then you'll get webinar access information back within 24 hours. Our webinars allow us to get into a lot more detail and show you many of the actual pieces that we have in our extensive marketing library. You can sit back and just listen or ask as many questions as you like. This could be the most important 60 minutes you've invested in growing your business. I hope to see you on one of them soon. Thanks for watching.